Hi, my name is Dr. Leyba. I'm actually a native New Mexican, born and raised in northern New Mexico. I grew up on a farm, working hard, using my hands all my life. I realized that education was the key. I was actually the first person in my family to go to college and then off to medical school. I did come to medical school here at University of New Mexico and had a great time. I then transitioned to my residency in a general surgery residency program in Phoenix at the Banner Good Samaritan Hospital, Level 1 Trauma, where I completed my training. I actually then decided to move back to New Mexico despite several offers I had in Arizona, just because I love the people so much. I love New Mexico, and it's a good fit for me. I ended up coming back to my roots back in northern New Mexico. I completed 3 years of general surgery in a rural place. Loved it very much, and just one of those things that something fell in my lap. I got the opportunity to do robotic surgery. I ended up taking that opportunity to move to Albuquerque, and I haven't looked back since. It's been very happy and pleasing to me and my practice. So here in New Mexico, especially here in Albuquerque, what we've started doing here at Loveless is doing robotic surgery on the general surgery aspect. So most surgeries traditionally have been done via an open techniques, and then in the 1980s they went to a laparoscopic technique, which is using small instruments to do the surgery through the abdominal region. The next step above that, I believe, is using a robotic platform, using the Da Vinci surgical platform to do those same surgeries with small incisions, just more precise, using high definition cameras. These new technologies that have progressed and improved our surgical experience. So if you think about this, the cell phone that you have in your pocket 10, 15 years ago, completely different from what it is now. So laparoscopic surgery essentially has been around since the 1980s. Not much improvement has happened in terms of giant leaps. However, the robotic laparoscopic platform has done that. It's given us high definition cameras, 3D visualization intraoperatively, which helps tremendously. So when you're actually doing the surgery, you have a depth perception where you can actually see in a three-dimensional manner versus on a TV screen where it's only two-dimensional. I can't stress how important that is for surgery. So what we've been doing is taking these new techniques and taking them to the next level and making them standard for our procedures. I've done the most single-site surgeries in all of New Mexico, including the first single-site surgery. We've had many firsts, including first stomach surgery, some of the first hernia surgeries and so forth. And this has just been I think we should applaud our program here at Loveless for doing this in terms of what other people are doing across the country. Each patient population across Texas or Arizona, they each have surgeons trying to do what we're doing, and here in New Mexico I think it's been working out very well for us. I just love the ability to actually help people, but what I truly love is to get in the operating room and just do surgery. Use my hands. Like I said, I grew up at a farm, a ranch in northern New Mexico, worked all the time using my hands, and so that's just kind of a special fit that I had. So when I was thinking of what I wanted to do in my life, surgery was one of those things that I think fit perfectly. And at the end of the day, after I've done my surgery and the patients have done well and I see them in clinic, just looking in their eyes and seeing that that sincerity when they tell you, thank you, Dr. Leyba, for helping me out and helping my family out. That's what makes it all worthwhile at the end of the day. That's what really drives me. Well, I hope you gain some insight on what we do here at Loveless Robotic Surgery. Again, I'm Dr. Leyba, and we're always welcome to answer any questions or take any consults that you may have. Feel free to give us a call, and I hope you have a good day. Thank you.